New and expecting mothers face many changes, not only to their lifestyles, but with their bodies and hormones as well. According to the American College of Obstetricians and Gynecologists, perinatal mood and anxiety disorders are among the most common complications during pregnancy or within the first year after delivery. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're discussing perinatal mood disorders, how the support person can help, and what steps to wellness mothers can take. With me today is Dr. Sarah Pearl, an OB-Gyn at St. Luke's Health System. Thank you so much for joining us.
Yeah, thank you for having me, Lindsay.
So Dr. Pearl, what is perinatal mental health?
So perinatal mental health, it's important to recognize that this is a wide range of symptoms and issues that can surround mothers, both in the postpartum and also the pregnancy state. In the world of obstetrics, we classify perinatal mood disorders as something that is affecting a patient with their everyday activities or is really causing a burden on them.
So what are signs and symptoms that a new mom might have a mood disorder?
So signs and symptoms can really vary, and it's sometimes difficult to distinguish, what is concerning and what may just be normal part of pregnancy or postpartum. Some of those things that we experience as new moms or even recurring moms, such as crying every single day, fatigue, those are also sometimes things that cross into mood disorders. Mood disorders can vary too. They can be depression, anxiety, OCD, PTSD. So for my patients, I strongly encourage that if you have anything that's concerning, to bring these up with your providers. You don't have to wait for your next visit, but have those conversations, because that's going to allow us to differentiate if this is something that just needs reassurance or if it's something that's concerning.
Right. Okay. Are there any long-term consequences for untreated perinatal mood disorders?
Yeah, great question. So the American College of Obstetrics and Gynecology actually states that perinatal mood disorders that are not treated well in pregnancy can increase your risk for preterm labor and delivery, as well as intrauterine growth restriction. Additionally, there are studies that show that the infants themselves, after delivery, if mothers not treated well with perinatal mood disorder, can have an increased risk for mood disorder development themselves later in life.
Okay, very interesting. So how can the father or the other support person help identify the mother might be experiencing this?
Yeah, that's a great question also. I like to share with my patients my own history when it comes to this, and my history with generalized anxiety disorder and pregnancy. My husband was commonly the individual who brought to my attention some of the concerning signs that he noticed. It really urged me to get some support. So I always love when patients bring in their main support person. We sit in the office and it allows us that opportunity to discuss the things that they are noticing. Their partners or their support individuals have the benefit of knowing my patients outside of pregnancy, and I get to know them during pregnancy. So we can work as a group to kind of talk about these things and see if there's anything that needs to be managed.
Now, what are steps to wellness that a new mom can take?
So when it comes to wellness, I always urge my patients, set that bar low, especially in the postpartum state. So there are going to be times where you are so exhausted, you may not shower, you may not get to brush your teeth, and that's okay. I tell them, set the bar low with focusing only on making sure everyone's sleeping well, eating well, and has good hygiene, and that's all that really matters. When things get more concerning, though, I always mention to them about bringing that conversation into the office and to talk to us about it. It then allows us to look at other resources that might be available, such as discussing medications and trying to break down some of the stigma against other resources that are available to them.
Okay, so what other resources does St. Luke's offer new moms?
Yeah, so I'm really excited to say that St. Luke's has brought back its in-person support groups. And this is great, including our in-person lactation support groups for both moms who are currently pregnant or postpartum. This allows our mothers to come together to learn, to relate, and to see that everything's going to be okay and gain that support they need.
Okay, great. Well, thank you so much for joining us.
Yeah, thank you for having me.
To learn more about St. Luke's maternity services, visit stlukeskc.org/maternity. You can also find updates on other health news at St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.